This is a maiden edition of Stanford Ceremony and Award Presentation, which is organized by the Directorate of Nursing Services, Kebbi State Ministry of Health, in collaboration with National Association of Nigerian Nurses and Midwives, Kebbi State also. This is the first of the kind.
Through every generation, immaculate.
He's a scientist by profession, a politician by vocation. So please, distinguished ladies and gentlemen, join me as I welcome His Excellency, the Executive Governor of Kebbi State, Senator Abubakar Atiku Bagudu, ably represented by the Honorable Commissioner of Health, Alhaji Jafar Muhammad. Sir, you are welcome to this occasion.
For this occasion, yes, I'm proud to be an honor.
We're going to be on our feet and we give honor to this country. Thank you very much.
We are called to serve humanity, endowed with the art and science of caring. We are built on integrity and discipline that transcends through every generation.
I want at this point to welcome on stage the father of all the nurses in the state, the chief host of this program, the Director of Nursing Services, Kebbi State Ministry of Health.
I want to begin by appreciating all the invited guests and welcoming them to this important event of the first of its kind, that is the sent forth for our retiring chief nursing officers. The idea behind this is just to come together and celebrate our own who put in 35 years of humanitarian services to their fatherland. Many have started but could not see the light of the day. But God in His wisdom spared our lives to witness today. As such, we need to come together and celebrate and also wish them well in their future endeavor. Thank you very much again. Thank you and thank you. God bless you.
Your Excellency, invited guests, distinguished ladies and gentlemen, at this point, I want to welcome on stage the political father of all the nurses in Kebbi State. I want to welcome on stage a nurse politician. And I want to welcome on stage a leader, which is the chairman of National Association of Nigerian Nurses and Midwives, Kebbi State, Comrade Abiwale Okelari.
Immaculate and amicable.
Your Excellency, sir, the Executive Governor of Kebbi State, who is heavily represented by our humble, passionate, courageous, Honorable Commissioner, Ministry of Health, Honorable Jafar. Permit me to start by saying that it gladdens our heart to have you here for this maiden edition of Stanford, even though we have had the previous Stanford in history of NANNM in Kebbi State. But this was called a maiden one because we articulate all the bodies together in order to see all the beautiful faces you meet today here. Retirement is a time of life when one chooses to leave the workforce behind. Putting up this gathering is our own little way of saying thank you. Job well done. Because the way to start rewarding a worker is to learn on how to tell him thank you. Your Excellency, sir, may I inform you that starting from the decoration of this hall was done by a nurse. The MC of this gathering is also a nurse, and also the DJ over there is also a nurse. We have so many entrepreneurial activities coming up in nursing cycle in Kebbi State.
Alhamdulillah for this innovation that has taken place today. We never had it so good than now. For those who thought over this and implemented it well, we really appreciate you. For those who don't know who I am Sheikh Aliu Sambawa, the first NANNM chairman in Kebbi State. The retirees, virtually everybody who stood up here was saying you are just retired and not tired. And the Honorable Commissioner must attest to that. all those who came forward to receive our retired nurses, they are very, very capable of continuing one thing or the other. So I urge the Ministry of Health, or rather Kebbi State, through the Ministry of Health, to find ways and means whereby you waive the years of training, not to be counted as years of employment.
It is a great honor for the Nigerian Medical Association to be invited for this important event. Looking at our celebrants that have worked tirelessly serving the people for 35 years is something to celebrate together. We congratulate you and we also wish you happy retirement. Studies have shown that people who have engaged themselves, engaged their brain positively, are unlikely to develop medical conditions like dementia. If you have seen elderly people, part of their problem is dementia. People will sit down, they could not even recognize themselves. So people that have engaged mentally have been found to have a better life even if they stay longer. Because dementia is commoner among people aged 70 and above. So we pray and hope that many of the celebrants will last more than that. So you should engage yourself in doing things. People that engage, even business, adding 1 plus 2, 2 naira plus 5 naira, 7 naira, you know, that their brain is more active than to just go and sit down idle.
If we stop doing nurses because we are retired, we get old faster. So you must do nursing after retirement. And the good thing is that the moment you have salary or rather income with no savings, you are just one step above the poverty line, especially serving nurses. Try by all means to create what we call a dedicated account. Find the type of amount you can afford. If it is 500 naira, if it is 1,000 naira, if it is 2,000, 5,000, 10,000. That dedicated account, you should not touch it until when you retire, and that will be a stepping stone for transition of leaving the job and doing something.
As a nurse, I have always been proud to be a nurse, and I have always wanted to diversify as a nurse and show that nurses can diversify. They cannot just remain in the clinical area because they are nurses, as is being erroneously believed. And that's why I would want to talk, and I have always been saying it anytime I have the opportunity, that nurses should move out. Nurses should ensure and see and change what the erroneous belief is, that we can only perform at the clinical area, that is beside the patient. That is humanity. Anywhere you diversify, you can still continue to provide humanity to whoever is in need of it. So on this note, I would want to say a very big thank you to the organizers of this big function, and for finding it worthy of maybe calling those that are retiring. This is something to encourage us. This is something to tell us that as we are going, we will be gratified for what services we have provided to the health as a whole, not just nursing.
It is my pleasure to be here today on a well-deserved initiative made by the Directorate of Nursing and Association of Nigerian Nurses and Midwifery, Kebbi State, to bring about a maiden edition of celebrating excellence in the area of nursing care profession in Kebbi State. This is a wonderful initiative and it is highly appreciated. Indeed, it's a motivational factor for our professional nurses so that they can work hard to excel, so that they can be recognized in a day like this today. This initiative is a noble one, and we'll give it support for it to be laudable so that we can continue to encourage the coming in nurses so that they can deliver their best in rendering services within the healthcare system of Kebbi State. We want to appreciate His Excellency, the Governor of Kebbi State, Senator Abubakar Atiku Bagudu, for creating an enabling environment for us to be able to discharge our responsibility, for us to be able to continue to inject human resource for health within the Kebbi State healthcare spectrum without having much difficulty. You know, it has been a tradition and it has been maintained by His Excellency that we enroll students and immediately we enroll them into the service, and we continue to give them allowances so that they can have the strength and the capacity to be able to train. And I want to tell the permanent secretary, the directors of all the Kebbi State Ministry of Health, even if it's going to be an in-house, we are going to start training, you understand, entrepreneurship within our own normal activities, so that we can be able to sensitize our people.
I feel privileged and honored to have been asked to deliver the vote of thanks on behalf of the retirees, that is the recipient. First of all, I would like to extend our appreciation to His Excellency for giving the ministry, or the staff, nurses in particular, the enabling environment to work. Just like what our mentor said, in the past, before the beginning of this administration, we have so many general hospitals that have been rendering skeletal services. But with a good budgetary provision to health sector, I can tell you that we have over 30 general hospitals working, functioning effectively in the state. I would like to appreciate the Honorable Commissioner for finding time to be with us, considering his tight schedule. Thank you very much, sir. The chairman, NANNM, and his executive for the wonderful job for conceiving, planning, and implementing this activity for today. And the other people also who have so many things to do. On behalf of myself and the retirees, we thank you very much.
Please join me as I welcome on stage the guest speaker for this gathering.
So we have divided this paper into two. The aspect of entrepreneurship and also the aspect of retirement. So what I have done simply is to discuss who an entrepreneur is, and as you can see, the word entrepreneur is derived from the French verb entreprendre. It means to undertake, and it was in the early 16th century that a French industrialist who organized and led military expeditions were referred to entrepreneur. And this is a credit to Richard Cantillon, a French economist. Since that time, the word entrepreneur has been applied to mean one who takes the risk of starting a new organization or introducing a new idea, product, service, or service to the society. That is a person or group of people who are engaged in business under a capitalistic system. Yes, our concept of entrepreneurship. Entrepreneurship has been associated with the willingness and the ability of individuals to seek out investment opportunity and to establish and run an enterprise successfully. While going into business, you must bear in mind what you intend to achieve as far as the establishment of that business is concerned. Perceptive. An entrepreneur should be able to understand how each separate decision relates to accomplishing and establish goals. Here you are expected to acquire that quality of inquisitiveness. Problems of Nigerian entrepreneurship. There are a lot of problems that you are expected to encounter as you find yourself in the larger society engaging in entrepreneurial activities. The issue of capital formation, even though now we have a lot of ways of accessing entrepreneurial finance, that is why I advise that a workshop or a training should be organized for our retirees in order to acquire most of this knowledge, most especially when it comes to the issue of capital formation. What are the sources of funds and the advantages of each of the source, so that you'll be able to pick or select a particular source that conform with your business operation. We have seen what is happening to these CBN facilities. We have seen what is happening to most of this intervention. by international communities. Even we ourselves, we are not fair to ourselves. You access 500,000 naira, you access 1 million naira, you access 700,000 naira, meant for entrepreneurship, meant for establishment of a business venture. But you go and buy motorcycle, you go and buy handset. The benefit of retirement. It's a benefit given to you to manage the rest of your life, but you want to spend it in one go. So these are some of the problems we have in the country. Competition from imported goods. The Nigerian nature, we don't want to consume our homemade products because of their inferior quality, or because we want to show up, we want to stand out. So you don't buy Kebbi, burning Kebbi bread, you prepare the one that is imported from abroad. The issue of managerial problems, insufficient preparations, lack of business connection, low level of business education, poor health, lack of experience, luck, are all problems facing entrepreneurship in Nigeria. No matter how prepared you are, I want you to bear this thing in mind. It is not the preparation that matters. That is why we always advise that the preparation should be accompanied with prayers. Because if you are not lucky, no matter how good you are, how prudent you are in managing the resources you have, if you are not lucky, whatever you touch, you discover that it is gone. So you have to exercise patience when going into this kind of businesses. Like the issue of blood bank. Most of us go to the hospital and donate blood free of charge. And now you want to open a blood bank, will be something strange. But with time, definitely, we know we are getting there. But it's good for you to be among the starters. Some people who exploit that opportunity. Career advisor, this is also another area. You may have customers here. People will approach you for nursing, for medical advice. You open your consultancy, you register with the government, and you open your office. Before you know, you prosper, because already you are retired. Child care center, diagnostic center, dietitian or diet planner, dietitian, home services, medical practice, etc., etc. These are areas that we can exploit. We can go, and with careful planning, with proper consultancy, we'll be able to